So today is a day for a centering reunion, which is a group of women who have been meeting for their prenatal visits once every 3 weeks and are now coming back after their births to share their experience with the group. Centering is group prenatal care. A lot of people tend to describe it as classes. However, while there's a large educational component, it is prenatal visits. So essentially, traditional care is where you would make an appointment, come in, see your doctor for 10 or 15 minutes, and leave. With centering, you come in with a group of women who are due with their babies in your same month or span of time. You take your own blood pressure, you dip your own urine, we listen to baby like we normally would, and then we have a group session for an hour and 15 minutes. With that time, we're able to cover a variety of topics related to pregnancy and childbirth. We're able to bring in auxiliary speakers, pediatricians. Sometimes we'll have a lactation consultant, a yoga instructor, a massage therapist, whatever the group wants to do with their time. And what happens within the groups is that patients get to know each other, they share their life experiences, often play groups develop, people have babysitting co-ops develop, and there is a group relational component that we cannot control. So it's been a really wonderful experience for us as midwives to be a part of and just to kind of see these groups develop. One of the reasons that we decided to start centering was that there is a big study going on in South Carolina where we have a fairly high preterm birth rate and growth retardation rate. And with centering in pregnancy, we're seeing that drop by 40%, proven. And we don't know why. We don't know whether it's the relational aspect, whether it's more of a peer pressure with things like nutrition, whether it's education, or whether it's just the decreased anxiety that people are experiencing when they're in the groups. But that is one of the reasons that our doctors were motivated to allow us to start the program. Clinical nurse midwives, and all three of us here are master's level nurses. So we all came from a labor and delivery background where we worked as labor and delivery RNs, then went back to school and became master's prepared nurse midwives. And so we are experts in healthy, well, normal. We tend to be fairly holistic in that we consider your relationship with your husband and what you're eating and drinking to be just as important as what is the baby's heart rate and what is your fundal height. A lot of our groups are in touch with one another online. They develop Facebook pages, and so they're in communication with each other on a daily basis. And what's wonderful about that is, for example, if you're having trouble with your baby at home breastfeeding, you have questions or concerns, a lot of times instead of seeking their healthcare professional, they'll throw it out there to the group because someone else in the group has had the same problem and has been able to solve their own problem with this or that tactic, and so then they share it among themselves in the group and they solve their own problems. So it's a really great way for women to kind of take responsibility for their own health care. So traditionally what we do is have either 8 or 9 sessions, and then at the end we have one more follow-up session. However, our very first group that is meeting is still getting together on their own every 6 months. So those babies are 3 years old. So this program has been ongoing now for 3 years, and they are still getting together. So the traditional structured part ends at the end of our reunion group, which this will be their last session. But the groups go on meeting on their own casually.
I just recommend it. I think it's great, especially for first-time parents.
The group feel that just questions that maybe I hadn't thought of asking myself, maybe somebody else had brought up in conversation. It's good to learn.
We talk all the time on Facebook. I message all the girls mostly.
It's so nice to be able to call somebody like, hey, what's going on with your little one? Like, oh, okay, I'm not crazy. Like, just having somebody to going through exactly the same thing you're going through is really nice.
And why we didn't think of this, 200 years ago, I don't know, but it has been really an awesome experience.